For research and the development of new drugs, diagnostics and vaccines, the pharma and biotech companies of industry need patient samples. And hospitals are a major source of patient samples, including samples removed at surgery, blood samples, sputum samples, urine samples, and many other types. Now, these samples may be taken for diagnosis or they may be taken for treatment. And if there is surplus material, then with the patient's consent, this material can be used for research. Many hospitals have dedicated units called biobanks, which take responsibility for collecting, processing, and storing leftover samples for research. These biobanks must have high professional standards. They must handle samples very carefully and in a standardized manner in order to make sure that the samples are high quality enough to be useful for research. If samples used for research are not high quality, then research results will be unreliable. And it is a simple case of garbage in, garbage out. Hospital biobanks are almost always set up for the primary purpose of supplying researchers in academia, that is, researchers in universities and research institutes. They're not set up to support researchers in industry. The result is that hospital biobanks generally give requests from industry a lower priority. Now, that's bad for industry research because when it comes to patient samples, the garbage in, garbage out problem affects industry researchers as much as it affects researchers in academia. And that's bad for all of us because industry research plays a vital role in the development of new drugs and diagnostics and vaccines that we all need. So it's extremely important that industry gains access to the high quality samples that only a professional hospital biobank can provide. So something needs to change.